So handling needles in a radiography laboratory is also part of the precautions, right? That's the lab safety rules, ensuring that nobody's coming down with any injuries in the lab and all of that. So handling needles waste in a radiography laboratory. So let's quickly look at these aspects of the lab and try to make some sense out of it. So needles are actually, very deadly, because imagine a patient had HIV, then you took out, maybe you put in contrast into the patient, that's intravenous contrast, you drop the needle anyhow and somebody matched it and the person now has HIV for life, okay, and many other things. So handling needle waste in the radiography laboratory is quite important. Let's talk about it. So it's a very important aspect of infection control and what? Occupational safety. You don't want somebody to come to the laboratory and get injured as a result of your ignorance. So since radiographers may administer intravenous contrast, which is mainly the case, or some medications, probably you want the patient to sleep or something, so they deal with a lot of needles in the radiography department. So use Sharps container. So dispose all the used needles into a puncture-proof or leak-proof Sharps container. So the container should be clearly labeled. Okay, so on needs, you label it clearly that what is inside here is needles. You put a sign, which you could see a biohazard sign there. And always the container shouldn't be too full that is overflowing. No, if it reaches about 3/4, okay, or 2/3 of the quarter, you just take it out. Okay, so no recapping policies, or needles used should never be recapped. If not, somebody might feel like, okay, it's capped, so it wasn't used. So if recapping is unavoidable, use one hand scooped technique. Okay, that's by the way, you shouldn't recap at all. So also personal protective equipment, you could see that this person is having what? This thing, what do they call it? Glove, and also wear the full attire, you understand, so that you avoid all those splashes that occur in the lab. There's safe handling during procedure, so you have to keep needles in sight. Okay, like don't just throw the needle anyhow, keep it where you can see it till you dispose it. So segregation of waste is needle waste should be separated from the general waste. Okay, final disposal, make sure that it gets to a good place. If it is somewhere that it can be recycled, then it's recycled appropriately, and the rest of it. So in case of an injury, then you try to wash the area immediately with soap and water. Okay, hand hygiene, general body hygiene, okay, because the needle could be any part of the body, so hygiene is very, very important in this aspect.